Let's talk a little bit about the treatments for urgency incontinence and overactive bladder. Now, overactive bladder is fairly common even if you haven't had previous prostate surgery or radiation. It can be extremely bothersome. You may have symptoms of urinary urgency. You may have to void frequently, perhaps even every hour. You may have to wake up 2 or 3 times at night to urinate. Patients can be quite irritated from this. It can interrupt your sleep pattern, make you tired during the day, and you really have to plan your activities around where the bathroom is. So the good news is there are many treatments that are quite effective for overactive bladder. What we want to do with these treatments is stop the bladder from spasming and causing you this sensation that you need to go to the bathroom or preventing you from getting there in time. Initially, we'll make behavioral recommendations. We'll have you perhaps change your diet a bit, avoid products such as caffeine, avoid spicy foods, minimize carbonated beverages. That will help substantially, so you may need to modify your lifestyle a bit. We'll also teach you about pelvic floor exercises because getting better control over your pelvic muscles can reduce urgency as well. And occasionally we'll even send you to a pelvic floor physical therapist to train you how to do these exercises properly. Unfortunately, not everybody will see benefit with behavioral modification alone, and for those patients, there are many drugs available on the market to treat overactive bladder. If you watch television these days, you'll see commercials come on all the time for various pharmaceutical agents, all of which are effective. So about 70 to 75% of patients will see improvement with pharmacotherapy or drugs. The problem is that not everybody will get better on drugs and not everybody will tolerate these medicines. It's always a balance between how well the medication works to alleviate your symptoms and what the side effects are and what's the cost of the medicine in terms of your out-of-pocket expense. If a drug's working well, has very few side effects, and doesn't cost you very much, you're going to stay on it. If a drug isn't helping very much, is expensive, and is causing side effects, you're not going to stay on it. So a large percentage of patients in our practice may need to go on to third-line therapies. What third-line therapies for overactive bladder are ways that I can treat you with a procedure of some sort to get you either greatly improved or dry. These procedures, which include Botox injections into the bladder, sacral neuromodulation or interstim therapy, or posterior tibial nerve stimulation, are all available in our office and all work quite well. For patients that have failed pharmacotherapy, there are excellent minimally invasive treatments available to treat both overactive bladder and urgency incontinence. These treatments include Botox injections into the bladder, which can be performed in the office, posterior tibial nerve stimulation, which can be performed in the office, and a procedure called sacral neuromodulation or interstim, which is an outpatient hospital procedure. I'm going to talk more about all of these therapies, which are all fairly easy to perform and very effective. For patients that have failed pharmacotherapy and behavioral therapy, Botox injections can be extremely effective at curing overactive bladder and urgency incontinence. This has really been a revolution in the way we treat overactive bladder. Essentially, what Botox is, it's a neurotoxin which weakens the bladder muscle to the point where it stops overactive bladder spasms. This procedure is done in the office under local anesthesia using a small telescope. Essentially, I inject several sites in the bladder with the medicine in a procedure that takes less than 5 minutes, and within 2 weeks, patients see benefit. Essentially, the medicine will stop the spasms, reduce urgency, reduce frequency, allow you to hold the bladder longer, and stop those embarrassing episodes of incontinence. Over 85% of patients will see benefit after Botox injections with little to no side effects. The medicine does wear off over time, and so it may need to be repeated on average about every 6 months. For some patients with refractory overactive bladder and urgency incontinence, an excellent therapy is sacral neuromodulation, otherwise known as interstim therapy. It's a really novel therapy, but it's been around for more than 10 years. Essentially what this therapy does is it modulates or changes the nerve fibers. So essentially when you have overactive bladder, abnormal stimulation is happening from the bladder going back to your spinal cord, causing your bladder to be irritable or overactive. With electrical stimulation of these nerves, we can gate these nerve impulses and stop these abnormal signals so that you can get normal function occurring again. So what we want to do is stop the abnormal impulses and just allow the normal impulses. The nerves I'm talking about are the sacral nerves, which travel right behind the tailbone. I can actually insert a small wire next to these nerves and send you home for a test period of 1 to 2 weeks. During that test period, you'll have an external stimulator, which is attached to your belt line, which will send signals chronically to the nerve. We'll see you back in the office approximately a week later, and we'll see how you did. If you see improvement, more than 50%, we can move on to the second stage where we implant a small pacemaker-like device and connect it and internalize it to the wire so that you have chronic sacral nerve stimulation. I'm going to show you what the device looks like. It's a very small device. It's implanted in the upper buttock and connected to the wire. And this battery and computer can stay inside your body for 3 to 5 years before it needs to be changed. So essentially, once you put this device in, your overactive bladder will be cured or improved, and generally you don't have to do anything. You just set it and forget it. If patients aren't achieving the amount of improvement that they would like to see, they do get a remote control, which we'll teach you how to use. So you could turn the stimulation up, or you can change where the stimulation is to the desired effect. Sometimes patients will come back to the office if need be, and we can reprogram them. But more than 75% of patients with refractory overactive bladder that undergo an InterStim implant will see dramatic improvement. It works quite well. Posterior tibial nerve stimulation is also an effective treatment for patients with refractory overactive bladder who haven't seen as much benefit as they might have liked with medications. This is a little bit of a different type of treatment. It's not a surgical procedure. It's actually a procedure that's done in the office. You come into the office, you sit comfortably in a chair, and we insert a very small acupuncture-sized needle into your ankle. You stay in the office for 30 minutes, and during that time we stimulate the posterior tibial nerve. That sends impulses back up into the area of the sacrum where nerves go to the bladder and the sphincter muscle. Essentially what this treatment does is it teaches the nerve fibers not to fire inappropriately. So it's an effective treatment for overactive bladder, and it does not require any surgery or permanent implants in your body. And it's for some patients who can come to the office on a regular basis, it's a very effective therapy that they feel they derive a lot of benefit from.